Now we have an example of the rhombic flap or rhomboid flap on a pig's foot. The limbs of the flap are of equal length, and the angles are again 60 degrees and 120 degrees. The lesion is now excised by utilizing 15 blade and then picking up the edge of the lesion and now dissecting it free with a number 15 blade down to the subcutaneous tissues. Notice also the other limbs of the flap are the same length as the parallelogram of the rhomboid flap. The angles are approximately 120 degrees and 60 degrees, and that's how the other limb of the flap is fashioned. And now the incision is made along the superior limb, and now at an angle of approximately 60 degrees, the second incision is made, mobilizing the flap now with a pair of dissection scissors with the tips up. Again, you may use a 15 blade or dissection scissors. Be sure to widely undermine this tissue. And again, the tissue may be undermined using scissors or a 15 blade. You want it widely undermined so that the flap will be rotated into position so that it is not under any extreme tension. Notice the wide undermining in this particular case. Once the flap and adjacent tissues are widely undermined, then the flap is rotated into position. With the point of maximal tension of the flap here is seen with the first suture. All apices of the flap are then sewn. Here's the first suture at the point of maximal tension. It is at a corner. A corner stitch is not necessarily needed in every case, but you can see how nicely this flap is rotated into position to cover a defect. Now the second suture is placed in again at the apex of the flap, and again it's possible to use a corner stitch if you wish, but in this particular example we use just a direct interrupted suture technique. And the third apex is now approximated. Deep sutures, if necessary, certainly can be utilized when indicated after adequate hemostasis is obtained. And once all these corner stitches are put into position, then the wound is closed according to the principles of halving.